Imagine sitting in your doctor's office at 1 p.m. The cuff squeezes your arm, releases with a quiet hiss, and the nurse smiles. 20/80. Perfect. You feel like you've won the lottery. You're doing everything right. You go home, eat your low-sodium dinner, take your medications, and go to sleep feeling completely safe. But what if I told you that 1 p.m. reading might be the most dangerous false safety net in modern medicine? What if the real predictor of whether you will suffer a stroke, or suffer, or experience accelerated brain aging has absolutely nothing to do with your afternoon numbers and everything to do with what is happening inside your arteries at exactly 3 a.m.? I am Dr. Marcus Vance, a preventive cardiologist and longevity specialist. Over my career, I have watched countless patients do exactly what they were told, hit their daytime targets perfectly, and still suffer devastating cardiovascular events that seemingly came out of nowhere. We call this the daytime delusion. So, EMNT is arson. The truth is, your doctor only sees a 15-minute snapshot of your cardiovascular health. They are measuring your heart when it is awake, upright, upright and behaving. But the damage that steals your independence rarely happens in the middle of the afternoon. It happens in the dark. By the end of this video, you will understand exactly why waking up to use the bathroom multiple times a night is rarely just an aging bladder issue, it is a blood pressure issue. You are going to learn how a mechanical failure in your body is forcing your heart to work overtime while you sleep. And most importantly, I am going to give you a simple, completely free 3-step evening routine to stop what we call the nighttime fluid shift, lower your nocturnal blood pressure, and help your brain flush out aging toxins while you rest. But before we get into the biology, I want you to pause for a second and tell me in the comments, are you a once a night or a 3 times a night waker? Drop that number down below right now. Because that number isn't just an annoyance, it is actually a crucial vital sign that we are going to decode today. Let me introduce you to a patient of mine I will call Arthur. Arthur is a 68-year-old retired engineer living in Dayton, Ohio. By all standard medical metrics, Arthur was the model patient. He walked 2 miles every single morning, he avoided processed meats, and his daytime blood pressure was a pristine 120/75. But Arthur had a secret that he barely even mentioned to me during his annual physical, mostly because he assumed it was just an inevitable penalty of getting older. He was waking up 3 or 4 times a night to use the bathroom, and it wasn't just the disrupted sleep. Every morning, Arthur woke up feeling deeply exhausted. He had a mild, lingering headache at the base of his skull and a stubborn brain fog that took 2 cups of coffee and several hours to clear. He thought it was his prostate, but his urologist had run the tests and told him everything was fundamentally fine. He thought maybe he was drinking too much water with dinner, so he tried cutting out all liquids after 5 p.m. But nothing changed. He was still waking up at 1 a.m., 3 a.m., and 5 a.m. He was still exhausted. Listening to his symptoms, I knew we were missing the real story. So, I ordered something called an ambulatory blood pressure monitor. This is a small, specialized device Arthur wore for 24 hours that tracked his pressure every 30 minutes, especially while he slept. When the results came back, Arthur was stunned. At 2 p.m., his pressure was 120/75, just as we expected. But at 3 a.m., while he was fast asleep, his pressure was surging to 160/95. Arthur was suffering from a hidden, incredibly destructive condition known as masked nocturnal hypertension. To understand why this is so dangerous, you need to understand what your cardiovascular system is supposed to do when the sun goes down. Healthy human biology is designed to be what cardiologists call a dipper. When you fall asleep, your nervous system shifts gears, your heart rate slows down, and your blood pressure must drop by 10 to 20%. This nocturnal dip is not optional, it is absolutely non-negotiable for your long-term health. Think of your blood vessels like the plumbing in a very old house. All day long, those pipes are under high pressure. The water is rushing through, pushing against the walls to get blood up to your brain and down to your toes. If that pressure never drops, those pipes become stiff, brittle, and eventually, they crack. The nocturnal dip is the only time in a 24-hour cycle when the pressure is turned down. It is the crucial window of time when the delicate inner lining of your blood vessels, the endothelium, gets to rest, repair daily micro tears, and heal. But Arthur, like millions of seniors right now, was a non-dipper. His pressure stayed high, meaning his arteries were taking a brutal, high-pressure pounding 24 hours a day, 7 days a week. He never got a break. And because he was asleep, he felt absolutely no chest pain. He had no idea his vascular system was under siege. He just thought he needed to pee. But why does this happen? Why does a perfectly healthy cardiovascular system suddenly go haywire the moment you lie down in bed? Why does your bladder suddenly fill up at 3 a.m. when you haven't had a sip of water since dinner? The answer is not stress. It is not anxiety. It is a mechanical failure involving gravity, fluid, and a massive biological shift happening in your legs every single evening. And once you understand how this hidden mechanism operates, you can change your cardiovascular health starting tonight. To understand this, we need to talk about gravity. All day long, while you are standing, walking, or sitting in a chair, gravity is relentlessly pulling your blood downward. Your heart has to pump firmly to get that blood back up from your legs, but as we get older, our veins lose a bit of their elasticity. The valves aren't quite as tight. As a result, water begins to leak out of your blood vessels and pool in the surrounding tissue of your lower legs. Let me give you a visual. Have you ever taken your socks off at 6 o'clock in the evening and noticed deep, red, elastic indentations pressed into your calves or ankles? Maybe your shoes feel a little tighter at dinner than they did at breakfast. Most people brush this off as having tired feet or just being on their feet too long. But that swelling is actually dependent edema. It is fluid that has escaped your vascular system and is trapped in your legs. Now, watch what happens when you finally go to bed. You lie down flat. Suddenly, gravity is neutralized. All of that fluid that has been trapped in your calves and ankles all day suddenly has a clear, horizontal path right back into your bloodstream. Over the first few hours of sleep, liters of fluid shift out of your leg tissue and flood back into your veins. Your blood volume instantly spikes. Your heart, which was supposed to be gearing down for a quiet, restful night, suddenly detects this massive influx of volume. It senses that the pressure inside the system is climbing dangerously high. The heart panics. It sends an emergency hormonal signal to your kidneys, essentially screaming, "We have too much volume. The pressure is too high. Get rid of this water immediately." So, what do your kidneys do? They do their job. They start pulling water out of your blood as fast as they can, rapidly filling your bladder to vent the pressure. This is why you wake up at 2 in the morning and then again at 4 in the morning with an urgent need to use the bathroom. It is not because your bladder is shrinking. It is not because you drank half a glass of water with your dinner. It is because your cardiovascular system is desperately trying to bail out the excess fluid to save your blood vessels from bursting under the strain. But if you don't manage this fluid shift correctly, your kidneys can't keep up. The pressure stays elevated all night long. You remain a non-dipper, and this is where the damage moves from your heart straight up into your brain. This brings us to the morning brain fog, the lingering headaches, and the accelerated memory loss that Arthur was experiencing. For decades, we didn't fully understand why high blood pressure was so closely linked to dementia and cognitive decline. But recently, science uncovered an extraordinary mechanism inside the human brain called the glymphatic system. Think of the glymphatic system as your brain's overnight power washer. During the day, as your brain cells work, they produce metabolic waste. This includes specific proteins called amyloid and tau. If those names sound familiar, it is because the buildup of amyloid and tau proteins is the primary hallmark of Alzheimer's disease. When you enter deep, slow-wave sleep, your brain cells physically shrink. This opens up tiny channels between the cells, and cerebrospinal fluid rushes in, washing away those toxic proteins and flushing them out of your brain. It is an elegant, beautiful cleaning cycle. But here is the catch. That power washing system relies entirely on the precise pulsing of your blood vessels to pump the cleaning fluid through the brain. Imagine trying to flush a toilet or run a dishwasher while the main sewer line in your street is backed up under extreme high pressure. The water has nowhere to go. The system fails. When you are a non-dipper, the pressure inside your cerebral arteries remains violently high. The delicate vessels in your brain become rigid. They cannot expand and contract normally. Because of this high-pressure lockdown, the cerebrospinal fluid cannot flow. The power washer never turns on. The amyloid and tau proteins do not get flushed away. They get trapped in your brain tissue, accumulating night after night, year after year. That is why you wake up feeling like you haven't slept at all. Your brain is literally sitting in yesterday's metabolic waste. And there is one more massive culprit that guarantees this toxic cycle continues: your airway. I see this constantly in my practice. A patient comes in with treatment-resistant hypertension, and we eventually discover they have undiagnosed sleep apnea. When you have sleep apnea, the tissues in your throat relax too much and temporarily block your airway. You stop breathing for 10, 20, sometimes 30 seconds. Your oxygen levels plummet. Your brain registers this drop in oxygen as a life or death emergency. It triggers a massive release of adrenaline and cortisol to shock you awake just enough to take a breath. You might not remember it, but your body does. Every time that adrenaline dumps into your bloodstream, it violently spikes your blood pressure. If you are stopping breathing 15 times an hour, your blood pressure is spiking 15 times an hour. You are running a cardiovascular marathon while lying in bed. If you snore heavily, if your partner notices you gasping for air, or if you wake up with a dry mouth and a headache, you must bring this specific concern to your doctor. Ask your doctor this exact question at your next visit. Could my frequent nighttime waking be a symptom of nocturnal hypertension or sleep apnea? Do not let them just check your prostate or your blood sugar and send you home. Demand that they look at the cardiovascular and respiratory mechanics of your sleep. Because the beautiful truth is, you do not have to be a victim to this fluid shift. You do not have to let high nocturnal pressure slowly damage your brain. There is a way to actively intervene and help your body process this fluid safely before you ever close your eyes. In fact, by making 3 simple adjustments to your evening routine, you can neutralize gravity, protect your endothelium, and turn that nighttime power washer back on. Here's exactly how you perform the gravity reset routine. Step 1, the 30-minute pre-bed leg elevation. Remember that fluid trapped in the tissues of your calves and ankles all day? We want to force that fluid back into your bloodstream while you are still fully awake, ensuring your kidneys have plenty of time to process and filter it before you try to sleep. About an hour before your actual bedtime, lie down on your couch or your bed. Elevate your legs roughly 12 inches above the level of your heart using a sturdy stack of pillows or a foam wedge. Stay in this relaxed position for exactly 30 minutes. By doing this, you are neutralizing gravity on your own terms. Your blood volume will spike early, your heart will safely signal your kidneys, and you will likely feel the urgent need to use the bathroom right before you get into bed. You are proactively emptying the tank before your brain ever attempts to enter its deep healing cycles. Step 2, the 2-hour fluid cutoff. Once you have elevated your legs and successfully flushed out that excess daytime volume, you must not refill the system. Stop drinking all fluids exactly 2 hours before your head hits the pillow. If you take essential evening medications, swallow them with only a tiny measured sip of water. Many of my patients protest this rule at first. They worry they will wake up terribly thirsty in the middle of the night. But I promise you, waking up with a slightly dry mouth is infinitely safer for your brain and your heart than waking up with your nocturnal blood pressure violently surging because your vascular system is overloaded. Step 3, the amber light pathway. If you do happen to wake up in the middle of the night to use the bathroom, do not flip on the bright overhead vanity light. Bright, artificial white or blue light immediately signals your brain that the sun has risen. Your nervous system instantly dumps cortisol into your bloodstream, which aggressively spikes your blood pressure and rips you entirely out of the deep sleep phase required for that critical glymphatic brainwash. Instead, install a simple amber or red nightlight in your hallway and bathroom. These warm spectrum lights guide your way safely to prevent falls without triggering a chemical stress response, keeping your heart perfectly calm and your blood pressure low. Alongside this evening routine, many of my patients find remarkable success by supporting their vascular system with specific targeted nutrients. Magnesium bisglycinate, for example, is a powerful tool for cardiovascular health. It naturally supports the healthy relaxation of the endothelium, the delicate inner lining of your blood vessels, and promotes the deep, slow-wave sleep required for your brain to clear out Alzheimer's-linked proteins. It is not a magic cure that replaces good habits, but it is an excellent supporting player for a tired, overworked cardiovascular system. Let me tell you what happened to Arthur. Once we caught his masked nocturnal hypertension, we didn't just hand him another prescription pill and send him on his way. We implemented the gravity reset routine. He started elevating his legs every evening while watching the evening news. He strictly cut off his fluids at 7 o'clock. We also got him properly screened for sleep apnea, which he did indeed have, and we started him on gentle evening airway therapy to stop the nighttime adrenaline dumps. The physical changes were profound. Within just 3 weeks, Arthur completely stopped waking up 3 times a night. He was sleeping solidly and peacefully until 6 in the morning. When we repeated his 24-hour blood pressure monitor, his 3:00 a.m. pressure had beautifully dropped by 15%. He was finally a true cardiovascular dipper. Most importantly to Arthur, that morning brain fog completely evaporated, and his lingering morning headaches vanished entirely. His brain was finally getting the nightly power wash it desperately needed to stay sharp. This is the exact level of care and precision I want for you. The next time you sit in your doctor's office, do not just accept a normal afternoon blood pressure reading and go home with a false sense of security. Take control of the conversation. Ask your doctor this exact question: can we test my dipper status with a 24-hour ambulatory blood pressure monitor? And so, insure a monitor. Bring this specific concern to your pharmacist if you suspect your medications are wearing off before dawn. Be an active, vocal participant in understanding your own vascular mechanics. You have the power to protect your heart and your brain every single night. You just have to know how the system actually works. I want to know what action you are taking after watching this. Comment starting tonight. If you are going to use the gravity reset routine before bed, comment ars asking my doctor. If you are going to request an ambulatory monitor at your next appointment, comment sending this. If you know a friend or family member who struggles with nighttime waking and desperately needs to hear this information, please share this video with the people you love, save it to watch again, and make sure to subscribe to the channel so we can continue this journey toward long-lasting, vibrant health together. Stay safe, sleep well, and I will see you in the next video.